I think it's a significant effect with them, and I think it wears them down. I've interviewed any number of soldiers. I had a chance when I was a senior advisor to the chairman of the Joint Chiefs, Admiral Mullen, to go to a number of installations and to then sit down, particularly with the squad leaders, the sergeants, and then the platoon leaders, the sergeants first class, and some of the other senior NCOs. And they've been drained by this over many, many times. And they find that their lives have been disrupted. Things have happened that they didn't expect. They're dedicated, they're professional, they want to do the right thing, but it's been really hard on them and their families. And it's just a cumulative set of events. I mean, there's not one thing. And obviously there's a difference because different people have come into the Army with different skills and different strengths. But you have multiple separations. You have the very stressful conditions of being in the environments both in Iraq and Afghanistan. You have the problems that you get with sleep disturbances. You have exposure to environmental factors that they are not exposed to here. You have the emotional stress of being in combat and your life endangered and seeing your fellow soldiers' life endangered. The injuries that are incurred, both musculoskeletal physical injuries, as well as from the blast concussions, the TBI, and any number of other sort of things that can happen. Families are trying to hold it together. All that just sort of congeals, and it can exhaust these young people. What I think is a good approach is to think of this as a public health problem, and to understand that soldiers who've had 3 and 4 deployments, like Sergeant Bales, who've been injured, both have had a probable concussion. He had this foot injury that was probably he needed to rehabilitate from. His family life's been put under stress. They're at risk.